Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about knee tendon pain after surgery. Before I jump into that, be sure to hit that subscribe button so you can catch all things knee replacement surgery. So, there's a couple different reasons why it's rather common to have tendon or ligament or any type of soft tissue pain and discomfort around your knee after having a knee replacement. One of those reasons is that knee replacement surgery is a volume changing surgery. And what I mean by that is the volume, so the size, the space taken up by your knee joint after surgery is going to be larger than what it was before surgery. So before surgery you have a lot of breakdown and deterioration of the cartilage within the knee. You have a decrease in the fluid and the space within the knee. That's why you hear that bone-on-bone terminology, is because that normal space between the parts of your knee has decreased and now it's narrowed and there's less space. Well, when you have a knee replacement surgery, that space is going to be restored by the surgeon and by the new knee replacement. So that space is restored, that fluid is restored, and now the volume of your knee is increased. So any soft tissue, any ligaments or tendons that are around the knee joint, they're going to be stretched out and in a stretched out, taut position that they're not necessarily used to since you've had arthritis and changes in your knee over time. There's also going to be a lot of inflammation and swelling after surgery, and this can cause irritation, cause pain, cause discomfort, and just make the area very sensitive. A lot of the nerves and everything in and around the knee joint very sensitive to signals of pain and discomfort. So all of that is working together, and then of course after you have your knee replacement, now you're getting into physical therapy, you're getting back into walking, you're doing all these activities, so this area that's already pretty sensitive and stretched out and all these things is now getting a little bit of increased stress from exercises and physical therapy. And so what is needed for this is basically time for the tissues, the tendons, the ligaments, and everything to kind of build up their resiliency, build up their tensile strength, and this is going to decrease the sensitivity and improve the ability of these soft tissue structures to tolerate different activities and your day-to-day tasks. So how do we do this? Well, it's slowly getting into exercise, physical activity, doing the things that you would normally do in a day-to-day activity. As you do this, it's going to build strength, it's going to build tensile force of those ligaments, of those tendons, and they're going to be able to tolerate more and more over time. You can also do a lot of exercises that are specific to strengthening those tendons around the knee joint. So there's plenty of different exercises out there. Some of my favorites are quad sets, hamstring sets or hamstring contractions, bridges, seated knee extensions, straightening the knee out, squats, step-ups, lunges, deadlifts, sidestepping. All these things are going to build up strength, build up stability of all those muscles and all that soft tissue around the knee. Now, the thing is, you really want to find a happy medium with activity, with exercise, with physical therapy. I always stress this. We don't want to do too much and so much stress on the knee and onto the soft tissue that it causes a flare-up of pain and intense pain and stiffness and swelling that it sets you back and you can't even do anything for the next few days. But we also need to do enough to cause that adaptation, that stress that's going to cause the positive changes to the soft tissue, to the ligaments, to the tendons. So finding that happy medium. And it takes a lot of guess and check, so you really have to kind of play around with your frequency, your intensity, the type of exercises you're doing to find what you can tolerate and what's going to be beneficial, but what's not going to be too much to cause that flare-up. And like I said, with physical activity and exercise and getting back into your daily tasks, the tendons are going to build up their strength, the sensitivity of your nerves is going to decrease, the swelling, the inflammation is going to decrease over time, and you'll be able to tolerate more and more, and that pain will eventually subside to a very manageable level. I hope you found this video insightful and helpful. If you have any comments or questions, be sure to leave them below. Be sure to leave those likes, as that helps spread this video to other viewers. And again, please be sure to hit that subscribe button if you don't already. Thank you very much for watching.